Good afternoon, everyone. Hopefully you can see myself and Trina on the big screen in a bit more of a larger size. Welcome to the inaugural ACCHS Lunch and Learn corporate editions. Seeing that it's 12:02, I think we'll get started, and we've got a fairly full house. So before we get underway, I'd like to acknowledge the traditional custodians of the land you're all dialing in from today. For myself and others based in Perth, I pay my respects to the Whadjuk people of the Noongar Nation, recognizing their continued connections to land, waters, and culture, and all elders past, present, and emerging. The purpose of the ACCHS Lunch and Learn sessions stemmed from the AHCWA Corporate Services Forum, which many of you have attended previously and you've hosted over the past couple of years. And this is developed to provide staff working within the corporate services functions of WA Aboriginal Community Control Health Services with the opportunity to come together to hear from subject matter experts and discuss key issues, trends, and innovative ideas relevant to the corporate services. Underpinned by the ACCHS Workforce Network terms of reference, the delivery of the Lunch and Learn sessions will sit within the remit of the Executive Manager for Corporate Services at AHCWA, which is Trina. And just seeing that this is our first sessions, and for those of you who don't know me, I'm Joel. I'm the Workforce Coordinator here at the Aboriginal Health Council, and I will be hosting today's Lunch and Learn sessions. And the Corporate Services team will accompany me over the future sessions to be a part of these. So I guess to give you an overview of the Lunch and Learn sessions, these will be scheduled in every second Wednesday of every second month, so on a bi-monthly basis. And these sessions will include 30 minutes presentations from subject matter experts, and you will have your say on who you would like to see at these sessions, and time for Q&A at the end. So before I introduce you to this week's presentation, a few housekeeping matters. Please ensure that you are on mute while the presentation is being delivered. And we will be sharing the slides and have the presentations recorded and accessible via our members portal. And also, please hold off on your questions till the end of the presentations, but feel free to put them down in the comment section. And now to get started with this week's session. It gives me great pleasure to introduce you to Samuel Wyndham, Solutions Architect at Biz365. Sam is a customer-focused technologist bringing together software development, cloud computing, and AI. He provides clients with commercial solutions that are high quality, secure, and scalable. And Sam has a Bachelor's of Computer Science and have worked across the full scale IT lifecycle. Our session for this week will be on artificial intelligence. And as many of you know, AI is a buzzword in recent times, but that shouldn't stop you from using it safely within your organizations. In this presentation, you'll discover how to leverage AI for its benefits, displaying information in the right formats, gathering and classifying more information. Happy for you to take the floor, Sam. I'll take myself off spotlight and get you in the spotlight.
Thank you. Thanks, Joel. Yeah, it's a great honor to be part of this first Lunch and Learn session. Appreciate the opportunity. Yeah, so I guess we'll just jump straight into it because I want everyone to get bang for their buck for the time that we have here. So when I was thinking about how we put together this session, one of the things that I thought is most important to health organizations at the moment is how they can actually use AI practically. We've heard a lot about benefits in case studies and articles online and things like that, but very few organizations know what can I do right now. And so hence the title for this is Practical AI for Health. Just a little bit about me. I'm amongst many things, the head of operations at Biz365. I have worked in Aboriginal health for about 10 years, working with organisations like Punta Cana Aboriginal Medical Service, AHCWA, and Marankara Health Service. And more recently, with the emergence of AI, I've worked with North Metropolitan Health Service, looking at automating some of their discharge notes as part of an event that was done with AHCWA, which is the organization which does data exploration here in WA. So what's on the agenda for today? So firstly, we're going to look at why you should be using AI. AI is even though it's very, very overhyped, it is the biggest invention since the internet. And companies that are not getting involved with AI in some form now will be left behind in the future. And I'm hoping today you'll be able to see why in some form. We'll look at how you can make content with AI. We'll look at how to generate a slide deck, so a PowerPoint itself, and then we'll look at how we can collect feedback. So when throwing all of this together, I put together a little bit of a brainstorm, which you guys can see here. I looked at some of the use cases that I've researched and seen in the organizations that Biz365 works with, and put together these top 7 use cases, which is reporting automation. A lot of organizations that we're dealing with now are looking at how AI can be used to automate their reporting for funding bodies, how you can get meaningful metrics and tracking on the impact that programs are having throughout their communities. Looking at medical stock take and how AI can be used to automate and ensure that stock is current and supply chains are stable. Looking at staff management, how you can make sure that your resourcing is working efficiently throughout your organization. Looking at recruitment and how you can get the right staff for the job. Also reducing, in a very practical sense, misdiagnosis and having AI that can prevent a doctor from giving a wrong diagnosis. And then lastly, for administration work, looking at Excel, PowerPoint, and Word, and how those have been transformed with Copilot. So when we're talking about AI, there's a massive sort of umbrella that we talk about. Most of you will be familiar with ChatGPT, which was launched in 2022 and is sort of started the revolution for businesses looking at AI. More recently, Microsoft has released Copilot, and Copilot is like ChatGPT, but it is private, it is HIPAA compliant, and it's the solution that if you're not using within your business, you should be moving your staff to that, because what ChatGPT does with all of the responses and all the information that you feed it, it uses that for retraining, and so it's not very secure or private, and with sensitive information, you don't fall under any compliancy, unlike Copilot. The other thing that we hear about a lot is integrated software, and this is something that maybe some of you are not so much aware of, which is how Office, particularly the Word, Excel, and PowerPoint that we love, they now have all of these superpowers which enable you to do so much more. And this demonstration that we're going to do today, we're only going to be covering PowerPoint, but the ramifications for it are immense. And then also looking at other AI software features. So if you're using any software at this point in time, like a Logic QC, everyone's looking at AI software features, and these are the things a lot of software companies are getting excited about is how can we automate the way that we use software using AI. And then lastly is sort of custom software like what we built for North Metropolitan Health Service, which was looking at patient notes and how we can take all of these doctors' scribbles and transform all of these doctors' scribbles into meaningful notes that can be recorded into their management systems. These are sort of This is sort of the area I think that is most exciting and probably the least utilized. Outside of health, there's been many projects that we've been working on at Biz 365 in the areas of manufacturing, as well as human resources, where we've seen a huge adoption for AI. So yeah, this is basically a brain dump, and the reason that I'm showing you guys this as a brain dump is to show how we can actually use unstructured information like a brainstorm and actually get something really meaningful out of it. Oftentimes, when you're doing like collaborative things within your organization, the information looks a lot like this, and then people go away and then they expand on it, elaborate on it. Provide case studies, that sort of thing. This is where I think AI's got the most utility, and I'm going to show you exactly how we're going to do this with Copilot. So we've got this this brainstorm here. I'm going to take a screenshot of it, and I'm going to take us into Copilot, which will look a lot like ChatGPT. So bear with me as I share up my screen. Can everyone see my screen here? Yep, cool. All right, so I'm just gonna quickly screenshot what we've got here, and I'm gonna ask to get some meaningful information out of this PowerPoint, or out of this brainstorm that we've just done. And I'll say, what are the examples that are within the image? What are the use cases? And Copilot is able to take this image and it's able to pull information directly out of that image into a chat-like interface, exactly like ChatGPT. And furthermore, you're able to, from these unstructured, this unstructured information that we've got here, we're able to take this information and get a little bit more information on it. Because of time constraints, I'm going to show one of the features that Copilot has, which is a researcher, but I'm going to show you not live, but a previous conversation that I've had with it, because it takes a while. But we've just come up with these use cases within our chat, and we've seen that it's been able to get that information out of the screenshot. The next step, and this is something that Copilot enables you to do, is actually get research from these use cases. So what I want to know is, out of these use cases, what is the one use case that we should be focusing on as top priority, and what have other organizations been seeing success with? And so what I've gone through and done is I've gone to this researcher tool that Copilot offers, and I've gone and asked it to, based on this image here, please provide some case studies and scientific articles to elaborate on the importance of these case studies in AI. And what the research agent does, and you'll hear agent used a lot when we're talking about AI, is agents go and they are able to use tools to provide better information. So the research agent within Copilot goes and it will research the web and provide meaningful information on any topic. So in this case, got it, you're looking for case studies. So the agent also provides a way that you can have a conversation to refine the information that you're trying to get out of it. So if you're using it within one of your brainstorming sessions, you can use it to back up some of the information that you're trying to provide for it. In this case, it's asking if I need something specific, but I'm just going to say, go ahead and use the best judgment. And this will go through, and it takes about probably 10 minutes because it goes through and browses the web, and then it pulls together all of that information. I'll show you how that information looks. So as a researcher, please cite articles and scientific studies on these use cases within health organization. So I went through and asked it to go and cite the actual AI use cases that were put in there, and it went through and it found examples along with articles and citations to back up what we put as the use cases. And the advantage in this is that you're able to actually enrich stuff that you already know on the ground. So if you're working in a medical organization, you are the one who actually knows what the use cases are for the work that you're working on, and this can be used as a tool to enrich that information and back it up with statistics. So when you're looking at providing information to funding bodies and things like that, having enriched information is of huge benefit. So that's the impressive thing that we get with Copilot, is this ability to enrich the information. Furthermore, we're also actually able to classify the information. So one of the things that, again, it's using the researcher agent. So I haven't gone through and asked it to classify it up here because it'll be taking a little bit of time to pull it together. But you're able to, hold on. Session. Yeah, you're able to go through and re-rank the use cases based on AI. So AI is useful for reviewing and classifying the information. It's able to not only just do research, but it's also able to evaluate whether the research is valuable for your use case. So I've gone through, and what I asked was rank the use cases in the image above, which is the exact image that I provided to it before. Rank the use cases for based on real studies around health use for AI. So it went through and it was able to evaluate based on evidence and its own methodology, which it outlines here, what are the best use cases. So it looked at AI for medical imaging and diagnosis. It looked at AI for clinical decision support, AI in administrative efficiency, AI assisted robotic surgery, AI powered virtual assistants, AI and drug. So it goes through it and has created and ranked the case studies. I think that this particular version might not have re-ranked it correctly. Maybe I've got the wrong conversation. Maybe it's through here. Yeah, not sure where that's gone, but you can see that it's able to evaluate the information that you put into it, and this is all private and all HIPAA compliant. So you can have conversations in Copilot which are not going to be recorded, They're going to be stored in Australia. So you've got data residency all in Australia, whereas with ChatGPT, you don't have that. There's no medical compliance for the ChatGPT free version. They do have enterprise options, which can be utilized within organizations, but it's really it's best to use Microsoft 365 Copilot. And here's the other thing as well. Everyone gets this Copilot subscription out of the box with their user account. So if you're using a Exchange account, which is your email account, and it's with Microsoft and you've got all your apps, this comes for free. And the way that you can access this is by going to portal.office.com and then logging in with your own account. I recommend that everyone after this presentation goes and has a play and takes a look at their own research. This is, I'm trying to show practically how I've used it for creating even this presentation, and you guys will be able to apply these same principles to your own presentations and to your own purposes. One of the things which is so important with this is using your own creativity for how you can apply to it. So just bear with me for one moment. The next thing I wanted to showcase is now looking at this umbrella here. We want to look at integrated software and how we can use Office Copilot to create our own slides. So some of this won't be new to you. Everyone's used ChatGPT, I'm assuming. So you know, I guess the magic here is that Copilot is health compliant, but I'm not sure that many people have used Copilot. So let's jump into that. So firstly, I'm going to start up PowerPoint. So, and I'm going to get out of here. And I'm going to create a new presentation to begin with. And we're going to use Copilot in order to create us a list of slides based off of this these use cases that have been cited here. So I'm going to firstly copy from this response here, and I'm going to just move this over here. I'm going to ask Copilot if we can create a presentation directly from this. So firstly, we can just select create a presentation about, and if you're wondering, well, why doesn't my PowerPoint have this option? Well, this is enabled by in your administration panel. So if you've got IT, you can ask them to enable it for you. It is $40 per user per month, and that's a non-for-profit subscription. It is quite expensive, and I think that it's not going to be for every user. Where I would say people will get the most benefit out of it is in administrative roles rather than clinician roles in health organizations. But yeah, so we'll paste in this stuff that we've copied. I think that it's reached its character limit for this. We might just use a smaller version of it. We might just use the 6 that we had before. Yeah. So create me a presentation from the following use cases. We'll paste in that. And then Copilot goes through, and in a similar vein as ChatGPT, it will go through and will be able to create the PowerPoint directly off the bat. So we'll just paste in these ones here. and it will go through and generate all of the presentation slides, which obviously you can understand the utility in this is being able to create things so quickly, being able to create slides so quickly and have that information transferable from some non-structured session where you've just discussed a topic, and then you're able to pull in all of this information into a PowerPoint slide so quickly. It's a game changer. And so you can see already here that it's just gone through and created out all of the slides for that based on what we fed it. Now, one thing to note with this is even though a lot of the work's done for you, it's not going to be all of the thinking that's done for you. So it's pulled together a really good slide deck here, but AI is not very good at actually thinking through what it's produced. So a lot of this I'm expecting is not going to be actually accurate in terms of factual, but I mean, we can already see here we've pulled together a 27 slide presentation in like 2 minutes, which is just huge. So that's one aspect of it. Obviously, if we're wanting to, what happens when we're wanting to edit these slides is we'll be wanting to add in specific information. So if we go back to our big output that we got from our researcher here, we might want to make a slide directly based on some of the information that we've got here. So we can we'll do use case 2 here, and we'll ask just to report on. I'm hoping that it will hit within the text limits. Yeah, no chance. We can just add in another slide about just this information. So I've only added in a paragraph here, but the idea is that this technology is still in its infantile state. So for future references, there'll be more stuff that can be added into it. So we'll have more text in the future for it. But yeah, what I was saying before is that when we're looking at the information that's actually inside these, cool, it presents it all for you, but now the onus is on organizations to make sure that they know what they're talking about, because it's so easy for people to create content like this and pull together, interesting and meaningful slides using AI. The information becomes a lot more important, and so the information that's just being discussed in sessions like the session that we're having here has to be spot on. And that's all I wanted to show you guys for today. I think that's a fair amount to cover off. Is there any questions around any of the stuff that I've showcased with you today?
Anyone know?
Was there any surprises? I'm assuming people have used ChatGPT before.
Just had a question in the chat, Sam. So I'm just going to read it out. You can choose because we have a bit of time. So, the question is, how accurate is Copilot or any other generative AI tool for that matter? And do we still need to include in our prompts, do not make any information, or is this no longer necessary?
Sorry, I missed that last part, Joel.
So the last part was, do we still need to include in our prompts, do not make up any information, or is that no longer necessary?
I think it's still necessary. So with those research assistants, the information that you're pulling together, if you ask it to cite information that's scientific, case studies, real world information, it will produce better outputs. But at the end of the day, you still need to be responsible for what you're producing, and you need to be the subject matter expert, because the AI is very good at producing content, but it's not very good at thinking through what it's actually saying. And so the risk for health organizations is that you just let the AI go through and produce all of the information, and it produces the wrong outcome. And obviously, being in health, the wrong outcome is the consequences are pretty heavy.
Thanks, Sam. Another question. With regards to the agents under Copilot, are these at an additional cost or charge, or are we able to create them on our own?
Yeah, so currently you can do it all by yourself, and it's no additional cost. I don't know how long that will be for. The stuff I showed you with the PowerPoint generation, that is an additional cost of $40 per user per month. But the actual interface of having that private chat, is something that Microsoft's offering currently as part of your existing subscriptions already.
I just had a question, but we're the floor is open to ask any questions if you want to raise your hand, and then we'll get to your questions as well. With regards to the work you do in this space, have you come across primary healthcare providers or community-controlled health organizations that have already integrated any sort of AI into their organizational workflow? You quickly mentioned Logic and other software, so I'm just curious.
Yeah, so I can't say too much, but I am working with organizations at the moment who are looking very carefully at the benefits for providing funding bodies with the information that they need based on the outcomes that they see in their communities. And I think that this is of huge impact to Aboriginal health, because oftentimes, like, you guys being on the ground, you see the impact of the work that you're doing, but not being able to communicate that effectively to funding bodies with all of the requirements that are in place is a huge challenge, or at least it's a challenge for the organizations that I've been talking with. And so I think that there's huge capacity for artificial intelligence to come in and look at anonymizing information like counselor notes. There's things that AI can assess without a human having to look at it. So sensitive information like counselor notes, like sexual health outcomes, those sorts of things, which are difficult to or sensitive to and can't be directly linked to any particular data. There's ways that artificial intelligence really is helping with that. So yeah.
Thanks for that, Sam. Was there any questions from any other participants? Can't see anything in the chat, but I think I'll get in touch with you if we have any other questions that comes up in the chat or via email, and then we'll have that on our website posted. So I think every time I hear about AI, it progresses so fast in terms of the integration, as well as just from hearing about ChatGPT to Copilot, that's already baked into everything that we already have. I think we're not going to be seeing the end of it anytime soon. So with that in mind, we're wrapping up our first corporate services lunch and learn session, and just wanted to give a huge thanks to Sam for coming on board and talking about a topic that is of importance and of very relevant to the sector and to all of our member services staff. So Next session will be on the 12th of November, same time on the second Wednesday of the month, between 12 and 12:45 p.m. And we will be hearing from Sharon Wood Kenny, whose portfolio is way too big for me to go into, but Sharon is an advocate, a mentor, and a cultural lead, and will be delivering a range of leadership and organizational development workshops. So Sharon will speak on workforce culture, developing leadership and engagement. So we hope to share with you more details of the session and having you all be part of the second Corporate Services Lunch and Learn session. Have a lovely rest of the day, everyone, and we hope to see you at the next one. Thank you.
Thanks, guys.
Thanks, Anne.